Welcome to Monday night, and I continue to look at what's making news here on Newsroom Africa, Channel 405. Tonight, what is the state of our readiness to respond to hazardous situations? I'd like to get your views tonight on that at Newsroom 405. Otherwise, you can give us a shout on the WhatsApp number 072-110-5584. Every now and then, South Africa's capabilities to deal with both man-made and natural disasters is tested. Recently, devastating fires swept through parts of Cape Town, leaving extensive damage. Parts of Charlotte Maxeke Hospital in Johannesburg were also gutted, forcing an evacuation of the health facility. Both disasters took days to contain, with injuries to first responders. So tonight, we focus on this often neglected topic of disaster management in South Africa. Joining me to discuss this is head of the Gauteng Provincial Disaster Management Center, Dr. Elias Sithole. Gerald Muswatuba from the city of Ekurhuleni Emergency Services Training Academy, Gift of the Givers founder, Dr. Imtiaz Suleiman, as well as Associate Professor of Law at the Northwest University, Almain du Plessis. Good evening to you all, and thank you very much for your time, and gentlemen, to you here in the studio.
Good evening.
Now, assessing the state of citizens and community leaders and safety representatives and everybody else as far as we answer the question, are we ready should disaster strike? Now, if you look at what the definitions are of disaster, is a human-induced or natural occurrence or events that displace communities structurally, yes, economically, organizationally, spiritually, you name it, right? And it deprives them or takes away their ability to help themselves. In that particular instance, then, you've got the National Disaster Management Act that kicks in, right?
Yes.
When we're talking disaster preparedness,
yes,
what are we talking about?
When we are talking about disaster preparedness, we are talking about the preparedness of the communities, the structures within the community, and also the preparedness of the government institutions, and also the response mechanism which exist within the different spheres of government.
And what goes into that preparedness?
It goes the training, the awareness campaigns where you go to the communities, you do the awareness to the communities, particular to areas where they're vulnerable to a particular disaster or hazard, yeah, and then also to make sure that in some of the other communities, we train volunteers so that when something happened, they don't wait for government to come, but we have volunteers in the communities. But then in the government institutions, that's where we put structures in place, but also some of the resource which actually need us to respond in that particular hazard or a disaster.
Yeah. Now, looking at that broad definition and the broad amount of work that goes into being disaster prepared,
yes,
would you say we are a nation that is risk resilient or resistant?
We're moving towards risk resilience. Why I'm saying that is that we move away from the approach where we only wait until disaster happens, then we start to respond. But now we encourage the risk reduction, which means we go to the communities and we work with the government structures and NGOs, and then we make sure that we minimize the impact of any disasters there. So we are moving towards that. Yeah. Yes, we might not be 100% perfect, but it's work in progress.
Prof. Almain, we are, of course, in South Africa, not really prone to huge, spectacular disasters, the likes of volcanic eruptions, although I might stand corrected, maybe we might have had one or two small tremors here and there. But largely, when you're talking South Africa, we are talking situations where we're talking veld fires, in particular, around winter. We're talking informal settlement fires. We are also talking seasonal flooding. Would you say we are a country that is disaster resistant?
So I'm going to come in here from a legal perspective because that's my speciality. And I think we've got a really good legislative framework that enables many things. Like the previous speaker spoke, we are now not just managing disasters when they occur, the Act also enables different spheres of government to reduce the risk, to make sure that disasters does not occur. They say in disaster management studies, that a hazard is natural, but disasters are not. Disasters might be able, we might be able to prevent disasters by ensuring that the risk is managed even in the times when there's no hazards. It's also quite interesting around the time that we had the national state of disaster declared for COVID, we also had a national state of disaster declared for drought. So again, like most things in South Africa, we have quite a good legislative framework, but we have seen it not implemented optimally. Also, as the previous speaker said before, in many instances on local government level, it was very poorly implemented. The studies show that this is because initially the Disaster Management Act, when it was being written, it was envisioned to be placed under the presidency because the presidency's got it's easier for the presidency to rope in all the different departments and all the different ministries. And when it would rest in the presidency, it will also rest within the premier on the provincial level, and then with the municipal manager on the local level. And because it is now rather under the Department of Cooperative Governance, it doesn't form such a central role in provincial and municipal levels. And there we have seen, especially on the municipal level, very poor implementation. So in a sense, COVID did us a favor, because since COVID, we have seen many of these disaster management centers being put together and coming together. So that is something positive that came out of COVID. So legislatively, we seem to have the right idea here. What is also a little bit lacking from the studies that I have seen from the Disaster Management Act, it created the Interministerial Committee in Section 5, if I remember correctly. That committee hasn't sat in the past since it sat once since 2004, which is a pity, because if that committee was fully functional, we might have been able to better respond to something like COVID or maybe even the fires that we have seen lately. And the other thing is, it also makes quite and I think this is the positive thing about the Disaster Management Act. It's got quite, a consultative vision with NGOs, with people like Gift of the Givers, to bring them in when disaster strikes, to make sure that all the efforts are coordinated between civil society and government. So we've got a wonderful legislative framework that we are working on. So, sometimes it takes something like a disaster to see where we are faulting and to try and correct those failures, which in many instances I am seeing is being done. So yes, so from an implement side, you would need different studies to see how it's been implemented lately.
Right. Now, that legislation, Prof. Almain, if you look at it, it requires that disaster management be something that is continuous, something that is, as you mentioned, integrated, multisectoral, which means there needs to be that interministerial task team that is continually having these conversations, but not only that, continually in a process of planning and implementation. Now, if you're saying just a fundamental thing as that interministerial committee actually sitting and doing their work of processing and planning, that is not happening, can we then really say we are ready?
Well, as I said, we have now seen with COVID that we have a great legislative framework that enables quite good coordination not only between government departments, not only between different spheres of government, because that's also quite important that national government, can work with the different spheres of government, provincial and local, but also that it makes provision for civil society. And we have seen in COVID where the Act was not implemented well, and hopefully, by bringing in the fault lines, the government will rethink and realize, well, even during states of non-disaster, or we don't have disasters, it's equally important that we make sure that this Act is implemented and that all the structures are in place and that people know what to do, that every disaster, local municipal disaster center, got plans in place should something like a veld fire, because, Table Mountain, there are often fires on Table Mountain, so there should continually be plans what to do in the case of a fire like that. And I think that is quite important. Whether we are there yet, probably not, but I do think, especially COVID, because it's so all-encompassing and it involves everyone in South Africa. We all sat up and we realized there's this Disaster Management Act that needs to be monitored better during times of non-disaster, so that it can be helpful to either prevent disasters or to at least lessen the impact when a hazard happens, that it becomes a disaster.
Certainly. Mthethwa, let's bring you in here. Let's talk about then civil society, who are in most instances first responders in instances like this. And when you get into it, do you find that you're able to, I suppose, follow textbook guidelines as how you respond and you deal with disaster management, or do you discover other vulnerabilities and other conflicts within those areas where you're intervening?
There's no textbook approach. Every disaster is different. It's your years of experience in a disaster that makes you think on the spot. Our teams have been on the ground for 28 years, and in each area we respond differently according to the needs of the environment or according to the challenges that come up. So the most important thing in disaster intervention is you can have a basic plan. Okay, I'm going to intervene. I need some food. I need some blankets. I need to take some water. I have to wait for the fire to calm down. The firefighters will make sure to do their job. If the area is not too hot when you go in, those are the basic things. Then the next thing, you want to try to move people to a hall. You need to understand a hall 1 kilometer away is not going to work. People don't want to stay so far away from their homes, even though it's burnt or it's washed away, because their possessions, they are their life's possessions, even if it's only one stove or one bed or one pillow. It's their life's possession. They're not going to move away from there. So as much as you try, you won't be able to move people. Majority of them, they will stay on site. They'll stay outside overnight. How do we cater for people like that who will stay outside overnight in bad conditions, whether it's raining, whether it's hot or it's windy? Are we ready for that? No, we're not. We don't have that kind of support system. And, calling what aggravates people, and we've seen this many, many a times, when you've lost everything, and, and after a few hours, your child is hungry, your baby is hungry, you are hungry. Although, in the times of disaster, you are more anxious about what you've lost. But even in that, you are thirsty and you're hungry.
Yeah.
And then you wait for disaster teams to come and you ask, where's the food? And they say they're busy with the tender and they're busy with the contract and they're coming now. And sometimes the food comes 3 days later. Now that's not on. That's a recipe for rioting and causing friction. And every time we went in first with the food ready. Because once people eat, you calm them down and they settle. But our advantage is that we have a very good relationship with all the disaster management teams all over the country.
Right.
And actually, when the disaster happens, they call us first.
Right.
They tell us, please be on standby. We need your help to come in. And that happens all the time. From what the legal lady is saying, and the guy in Joburg, sorry, I can't see the people, the person in Joburg has said, yes, it is work in progress. But there are lots of flaws in the system. The flaws in the system is this. There's too many different divisions to deal with. You've got housing, they've got a part of disaster.
Yeah.
You've got local government, they've got a part of disaster. You've got a municipality that's part of disaster.
Hold on to that. I want you to tell me those challenges in categorically what they are when we come back from the break, and I'll give you enough time to be able to do that. Right, let's get your views tonight. Are you even aware of the safety plans in your community at this particular point? If disaster strikes, where to go and how to respond? Give us your thoughts on Twitter at Newsroom405. On WhatsApp, send us your questions and your comments. 072-110-5584. The Newsfeed Late Night continues for you next. Back with you now here on the Newsfeed Late Night, and your reporting continues as we have a conversation around our readiness to disaster management and the impact thereof and the recovery that ensues thereafter. As we continue with this conversation, I'm with the head of the Gauteng Provincial Disaster Management Center, Dr. Elias Sithole, Gerald Muswatupa, who represents the Brotherhood, Gift of the Givers founder, Dr. Imtiaz Suleiman, as well as Associate Professor of Law at the Northwest University, Professor Almaine Duplessis. Before the break, Dr. Imtiaz, you were outlining what the challenges are. Tell you what, because some of the studies reflect, for example, that when you go into a disaster area, right, straight, for example, in Alexandra when there were floods in 2016, the first responders, what they found is that when they come in, it's not just those who are immediately affected by the flood that they need to respond to. So you find that the need becomes bigger because right next to those who have been hit by the flood is also another community that is vulnerable. And if you don't see for the needs of that community, then there is conflict that ensues. Do you find that that is your situation on the ground?
That's always the situation on the ground. You know, in the same place that you're talking about, take the Yaxke River. Every year we go to do the same thing. Have people, water levels rise, people get washed away, children die, they get washed away. And one year we refused. We said, we're not going to do this anymore. And we told the city council, it's time to move the people to higher ground. Put concrete barricades, block the river, send the people up. Because once you move people up, then something else comes back down again. And this process repeats itself over and over again. And we said, no, we want to move the people up, block the river on that part of Alex, and let's build houses. We'll build the houses, give us a piece of land. And we did it. We put the houses higher up. And even in doing that, you can't take people 15 kilometers away from where they're living, because transport is an issue. Their work is nearby. There's a whole lot. They've grown up in that area. So that's one issue that moves people away from rivers, and that's an educational process throughout the country. People living near rivers, because a downpour comes suddenly and a small stream becomes a raging river in seconds, and and people get washed away. That's one issue. The second thing in those kind of developments, sometimes you have a mixture of foreign nationals and local people. And if the foreign nationals are affected and they get help, they get food, they get blankets, the local people think, why we did not get help? Why didn't we get washed away? Why didn't we get caught in the floods? And whenever you go into a community, if there's 300 families affected, and there's 350 families there, you have all 350 families. That's our policy, because it's not fair, because whoever has been affected were in a disaster even before the disaster happened. So that's our approach. We try to help as many people as possible. We cook extra meals. If one person eats a little extra, so what? They're not like rich people, you're going to get overnight rich with the food that we're giving them. So you have to take into account the sensitivities, the amount of people who live there, the different nationalities, what the circumstances are. Yeah. All those things have to be considered. But coming back to the earlier point, you need one command structure. You can't have social development bringing food, human settlements worrying about housing, fire department worried about engine, somebody else worried about water, somebody else worried about ambulance. And unfortunately, in this kind of system, there's a lot of egos. And each one wants to be better than the other one. And in the process, there's conflict. And always in the end, it's the victim who suffers. Yeah. We need to change the system, how we manage disasters. One agency runs everything, what the food, what the water, the blankets, everything from start to end. And we probably have a much better system. Because if we see it with every disaster, there's just too many competing agencies within government.
Change the model, says Inter Suleiman. I'm going to get Dr. Elias just to respond to that in a moment. But first, though, let me bring in Gerald here. Gerald, you work with the communities as a brotherhood, as the first responders, as the people who really hit the ground running when a disaster struck. Do you find that as a country we have a culture of risk avoidance?
Unfortunately, as the brotherhood, we don't do the responding part. The responding part is done by the firefighters. So the brotherhood is basically firefighters coming together to aid or to assist the public where we can. Yeah. But that does not involve responding to calls and responding to these disaster areas.
Right.
Yeah, and that's Mr. Stolle's.
Okay. So when you get to assisting the communities, right? Because part of the big conversation around disaster management is, as Dr. Elias mentioned, the education of the people. Educating them about hazards, educating them about avoidance, educating them about how to be prepared before time and evacuate before time, such things. I'm just asking you broadly, when you interact with the communities, do you find that as a country we have that culture of risk avoidance?
Yes, that's definitely what we are trying to do as the Brotherhood, and we're trying to basically share the light and get people to understand how the processes go and what needs to happen when and what needs to happen and what happens when. That is why we have partnered with the province and on the event that they have next week, actually tomorrow, not next week, on Tuesday, on the World Firefighters Day. Yeah. We are coming in as the Brotherhood with a message to the public. We're going to be having a march tomorrow to educate the public, or maybe to plead with the public. The one thing that we find that affects us as firefighters, emergency services personnel, police officers, metro police officers, securities, is that most of the time when we go out to go assist, we get attacked by the public because they are frustrated of whatever cause could be. So our message is clear, basically, tomorrow to say, listen, even though we are firefighters, we are community members before we are firefighters. Yes. We are community members before we are police officers. We are community members before we are emergency services personnel. So we are also human, like everybody else. Yeah. And the very same things that you're scared of, they're also a danger to us. Yeah. Yes, we are trained for them, but it's not as easy as everybody thinks it is. So that's what we're trying to deliver tomorrow, to educate, like you said. Do we think that people they understand? No. That is why the Brotherhood is coming in to try and educate where we can.
Yeah. Disaster management, it's never an easy thing, but as you're walking in, what would make your efforts less difficult, right, to actually have impact? What is it that you require from community as a response so that it makes your job easier?
I think the first thing is before we expect the community to do something is what do we do for the community? The one thing that we've realized is not there is understanding of how these processes work. When you phone a fire department, or when you phone emergency services, or you phone an ambulance, or when you phone metro police, when you phone police officers, what is the process before response gets to you? Yeah. And I think that's the one part that we're lacking, and that's the one part that we're trying to assist on, so that people understand what's happening. Because, you know, people think when you phone, and let's say, for example, you phone an ambulance and somebody says hello, they think it's actually the person in the ambulance who's answering the phone. Right. And when you respond there, they're like, I phoned a long time ago. Why do you guys take so long? Because they don't know the call has to go from here to the call taking center, from the call taking center to the dispatch center, from the dispatch center to the ambulance, and then the ambulance responds to you. Yeah. So I think it's those things that the community needs to understand, so that they're not frustrated when the response is not happening as early as they think it does.
Disaster management goes hand in hand, Dr. Stoller, with education, right? Risk reduction education seems to be lacking. It's supposed to be part of the curriculum, but I'm not sure how many teachers are aware that it needs to be a part of the curriculum, and it's actually ingrained in the curriculum, even at the lower grades, that kids are taught this.
Yeah. Yes. Look, there are structures which has been established from national, provincial government, and local municipalities. And then in those structures, specifically if I focus now on at the provincial level, you have a Department of Education participating in the structure. Then in the structure, we discuss all the mechanisms and initiatives and mitigation strategies which actually we need to execute out there. Then as a collective in that forum, then we have to work with the particular department. In this case, we'll say the Department of Education, to make sure that the kids at school, actually the issue of disaster management is there in the curriculum. Yeah. Because if, for example, we always believe that if you inform the kids, indirectly the kids will go home and inform the parents. Yeah.
That is the slogan, isn't it?
Exactly. You see, so having worked with the small kids, we do the awareness campaign, we give them pamphlets, and then indirectly we're able to change the culture and the behavior to their parents. So actually going back in terms of what is our approach, is the integrated approach in terms of dealing with disaster management, because you can't deal with issues of disaster management as a single department.
Yeah.
So you have to use the integrated approach. That's where the NGOs, they come on board, the higher institutions, the higher education institutions, they come on board with research in terms of which areas are more vulnerable. Then we as government, we can put then programs in place to address those vulnerable.
Just this question that MTS is raising, post-recovery and rehabilitation. It seems that you have people who are on the flood line, right? When disaster strikes, you lift them a little bit out of there into temporary shelter, and then you allow them to go back there. I mean, how are you managing that? Because part of it is supposed to then move them from there, they're not supposed to return.
Actually, if there's a disaster, we find that a particular area let me just make an example, like floods. You find that we have an informal settlement, and then that informal settlement is affected by floods. We'll then move the communities there. So what then happens is that new people then will see an open space and come and resettle in that open space. But now, what we are doing now, moving forward, as and when we relocate the communities, we then barricade the area, making sure that no one comes and then reside in that area where we have relocated the communities. Because you will relocate the communities, then next month or after 6 months, then again we have got informal settlement again in the very same area. Then which means each and every, in winter season, summer season, you'll continuously dealing with the very same problems. In winter you deal with fire incidences. Then in summer, then you deal with floods. So continuously you are dealing with the same problems in the same area. So, but if you relocate the communities, then you barricade the area, then actually solve the problem.
Right. And the fragmentation then in how you speak to one another in the various departments, housing, social development, health, and so on, because the needs then become almost one thing at that time. Yet you will have a civil society having to run into these different bureaucracies of the various departments as opposed to having a more coordinated response.
Actually, what happens is that if we have a disaster, we establish what we call it a joint operation center, commonly known as JOC. In that JOC, we have got all the different stakeholders. That include your community-based organization, the NGOs, government departments. In the JOC, that's where we manage the incidents. If we have to relocate the communities, that's where human settlement comes in terms of identifying the land where we can relocate the communities. The social development will actually look in terms of the areas where they need food, they work with NGOs to provide food. And then we'll come in and see what kind of other relief material we can actually assist. And then other departments, for example, like the Home Affairs, you find that other people then they've lost their IDs or let's say any, let's say some people have passports or any identification. Then Home Affairs will come and assist those people in terms of reissuing. Those
Let's find out if that happens in practice. Suleiman is with us, and he'll give us his views on it. Right, let's get your views as well on Twitter at Newsroom405, on WhatsApp 072-110-5584. The Newsfeed Late Night continues next. Back with you now here on the Newsfeed Late Night. Our conversation tonight on disaster management. We continue with that discussion. We have the head of the Gauteng Provincial Disaster Management Center, Dr. Elias Sithole, Gerald Muswatupa from the Brotherhood, Gift of the Givers founder, Dr. Imtiaz Suleiman, and the Associate Professor of Law at the Northwest University, Professor Almaine du Plessis. Prof, let's talk then about exactly that question of what the framework requires, right? National Disaster Management Framework requires that disaster risk reduction education must be integrated into our curriculum. What are the flaws there? What is not happening and what is happening?
Yeah, so I've also put the act here on my screen because I think it was interesting what Dr. Suleiman said about the different institutions that don't seem to cooperate, because the Act specifically provides for integrated and coordinated disaster management policy that will focus on the prevention and the reducing of risks of disasters, the mitigation of severity of disasters, emergency preparedness, and rapid and effective response. So the Act foresees to provide all these kind of institutions, specifically the disaster management centers, so you get them on national, provincial, and local level, and then they establish these joint operation structures. But the Disaster Management Center, the objective is to promote an integrated and coordinated system of disaster management, that emphasizes prevention and mitigation of disasters. So, it's really a question of why is this act not implemented optimally? And from what the studies I've read the past year, and I've by no means read all the studies, but it seems exactly that problem of educating, not only educating people, for instance, in school, but also educating people in the structures and local government structures, telling them this is what disaster management is, and these are the kind of plans that you must have in place. What is quite interesting is disaster management always have, in universities, they're not always sure where to place disaster management, but it's got a strong developmental focus. So it was therefore also interesting to hear the question, once a disaster strikes, how do you address the disaster? The idea behind the whole Disaster Management Act is that in the process of addressing disasters, you also reduce the vulnerability of people, which is why it was so interesting of Dr. Suleiman, who said, then you cannot just let people go back to the floodline. So there really is, and I'm not convinced it's only a problem with disaster management. I think we have a problem in this country with implementation and holding government account to implementing legislation the way that they should be implemented. And I think a big problem here might, for instance, be that an institute like the Intergovernmental or Interministerial, committee, do not sit. They do not sit. Every 4 times a year, I think they should sit in terms of the framework policy. And where are the people in government asking the questions, why is this committee not sitting? Because ideally, if that committee is sitting, they should ensure that the act is optimally implemented, and that's on national level, and of course, similar things should then happen on provincial and local level. So I think there's a big issue of governance and implementing legislation that we as a country probably need to start to ask questions about. How can we ensure that the duties that are created in terms of national legislation are being adhered to? How can we make sure that the Disaster Management Act is also implemented in times where we don't have disasters, to ensure that when there are hazards, that these hazards don't turn into big disasters, like we have seen, that people work together and cooperate, that the structures are there for cooperation, to make it also easier for people like Gift of the Givers, to come in and to meaningfully assist, but don't have to shoulder the bigger burden of addressing things like disasters.
How have you found your working with the Joint Operations Team? They call it JOC. Just a sense, for example, in one of the areas where you've had to intervene, there was a point where you really said, look, we're going to pull out here, because it seems as though you were in direct conflict with the municipality, where you're trying to provide water to the community, and it felt as if the municipality at the time thought you were trying to be government and you were trying to play their role, and you said, well, if that's how you feel, we're actually going to pull out of here.
Well, there's lots of issues there, Tabo. Let's start first with the disaster management. Disaster management guys, I feel, are not supported by government. They don't have enough resources. They're hardworking. They're well-trained. They're committed. They're dedicated. They go to areas. They do what they want to do. Come COVID-19, nobody provides them with PPEs. In so many areas you go, the fire truck is not working. There's one fire truck for many fires. Nobody thought about buying many fire trucks, especially over the years when there's so much of fires. Somebody would have said, look, we have so many fires here. Don't we need more fire trucks? Nobody thought about that. Sometimes they go to a place, the fire hydrant is not working. They look like the bad guys. And yet they are the ones that are doing all the effort to try to put a disaster off. So disaster management, in my eyes, are not the guys to be blamed. It's the people who are supposed to be funding them that have to take a big responsibility for this not happening. I'll give you another classical example. The fire in UCT in Cape Town, on the Berg, the first Sunday morning. It was Sunday morning, yes. Sunday morning, we got involved in the afternoon to help the students. After we fed the students, at 12:30, past midnight, my teams decided to go to the Berg, to the mountain. They met the firefighters and said, is there anything we can help you with? And the guys say, we last ate at 20 to 9 in the morning, which means 16 hours ago. And why should the public be providing food and water to the firefighter Isn't that the responsibility of government and the disaster management? But I'm not blaming disaster management. So shouldn't somebody be funding them? The people are putting their lives on the line, and yet the basic things are not provided for them. So that's a big problem. No fire, enough engines, no proper maintenance, not enough material for them, not taking care of their own people with long fires. That's one example. Makanda, the one you're talking about, we went in. It wasn't so much about the municipalities thinking that we did their work. They actually called us to do it for them. And it's a long story, but basically we told them, look, our intervention as an NGO is a certain amount of money. To fix a problem, it'll cost so much of money. Do you want us to do it for you? And they said yes. And we declared a disaster, and the money that you need to fix the stuff, we will pay for it. That never happened, and there was some issue of paying somebody else. That's why we pulled out. But our relationship has never changed. We're still in the municipality. We're still helping them. We're still helping the town or the city. It's about the people. But now, whilst talking about that, let's mention something else. Eastern Cape is in drought since 2015. So many areas are without water. Has nobody thought about buying water tankers? Why is it that for so many years there's no water tankers? That people need water and it's not available. And then somebody gets a genius of an idea and said, let's put JoJo tanks everywhere and put water tankers everywhere. But then you ask, well, where's the water going to come? Where's the source of the water for the water tankers and the JoJo tanks? Has anybody thought about drilling boreholes? Of finding more water because the dams are empty and there's no rain. So where do you get the water from? Has nobody thought the process through? And that's where the big challenge comes, where the act has to change. You can't be looking for tenders at a time of disaster. The Disaster Act should emphasize that you get the best people to do the job immediately. By definition, it means right now. Unfortunately, government doesn't understand three words: disaster, emergency, and urgency. Those words are not in the vocabulary. Because you can't proclaim a disaster and 6 weeks later. It doesn't make any sense. And then when you ask the question, when or how do we solve the drought problem? And some clever guy tells you, we're building a dam. Now you're building a dam when this afternoon, and this evening the water will be available to give the people tonight? Is that what you're referring to? The people need water right now. A lot of people who make decisions have never been on the ground. It should be mandatory that those people in office should actually go on the ground and see what's happening to learn for themselves how to respond to the crisis.
Right. Dr. Stode, the question of timing, a timeless response is also part of what is required in disaster management, including timeless alerting of the people on the ground of a potential risk that would occur, but also timelessly responding so as to minimize the impact of the disaster at the time. Your response times?
We have early warnings, and which we use actually to sensitize the communities, because we always believe that if your early warning systems are strong, then you are able actually to warn the communities, and then we can even activate structures in the communities, and then the impact of the disaster, we can minimize that. But also in terms of if disaster then it has struck, what kind of mechanism do put in place to assist the communities? Those that's where the integrated approach comes into play. Because as government, we'll then say, we have this kind of resources, but then we need other partners as well to come on board to assist government so that we can then assist the community. So we don't really throw everything to the NGOs or to the private companies.
I must tell you, as Professor Elmain was saying, the first time that we really saw the Disaster Management Act in action is now, during the time of COVID-19. And it was able to unlock a huge number of resources in a very short space of time, which is something that Give to the Givers are telling us now that they have not been able to do that in the many years where they've been assisting and managing disasters. When it comes to unlocking resources to assist, it's been a big challenge.
But also, you see, I would say COVID-19 is a blessing in disguise, even though there are a lot of people who have died in the process. I'm not saying that we like that. We don't want anybody to die. But COVID-19 also, it has assisted us to inform other people about what is disaster management, and then what kind of structures do we need to put in place so that we can deal with a particular disaster or a hazard. For example, and then people, when something happened, they always say, well, government actually, they will see, they will come and then assist us. But during COVID, we have seen all the stakeholders, private sector, NGOs, communities, actually taking this matter very seriously.
Yeah.
And then indirectly, you find that structures of government, they become effective in terms of dealing with COVID.
Okay.
You see, so moving forward, we can then build to lesson learned from COVID.
Yeah.
And then future disasters, we can actually manage them better.
All right, let's take a quick question from Thabo in the Eastern Cape, and we'll try and answer that question, or if it's a comment, and then come back and touch on the other issues as well. Thabo's in Alice saying there is a budget for disaster in this country, but some places go for months without water. Taps run dry, and municipalities don't even supply communities with water tanks. Where is that budget going? There's a question for you, Dr. Stewart.
Look, yes, at national there is a budget, which is, we call it a grant. It's a provincial grant, and then it's a municipality grant. And then you can access that grant if the disaster it has declared. Now, what we always encourage, especially when you go to the municipality space, the municipalities must go and do an assessment, come up with a report. We don't want to use a bottleneck actually to block things. So we're saying that assessment report, it will assist us to make decisions in terms of where are the areas of concern. Then we can channel the resources there. But also we always encourage that in some of the instances, you find that at the municipality level, you have budget which has not been used. Then we always say, municipality, reprioritize that budget. Yeah. Then you can then deal with the problem in your municipality space. Don't keep your budget there. Then you wait to say the province or the national, then they must give us the money. What is you are sitting with the money? So we work with the municipality to say, you have this budget, prioritize it, assist the communities.
Let's take a break. We'll continue next year on the Newsfeed Late Night with more of your questions, as well as our panel here as we wrap up this conversation at Newsroom 405. WhatsApp your questions now to 072-110-5584. The Newsfeed Late Night continues for you next. The Newsfeed Late Night continues now here on Newsroom Africa, Channel 405. Thanks for staying on. And, of course, our conversation tonight with the head of the Gauteng Provincial Disaster Management Center, Dr. Elias Sithole, Gerald Muswatupa with us from the Brotherhood, Gift of the Givers founder, Dr. Inter Suleiman, as well as the Associate Professor of Law at the Northwest University, Professor Almain Duplessis. So, Gerald, talk to me about injuries at work, right, and how that affects your psyche and your mentality going into disaster management. I mean, we saw some spectacular images now with the firefighters fighting fire and so on and so forth.
Jabo, it's, how do I put it? We deal with injuries every day. That's what we do at work. But when it's your colleague, the amount of trauma that one deals with, it's overwhelming. Mm. And not that you don't care when you deal with someone you don't know, but I think picture it as a parent. When you see someone hurt, you feel for them and you want to assist. But when it's your child, no matter how good you are, even if you're a doctor, when it's your child, it becomes a bit difficult for you to deal with. So the trauma is, it's how do I put it? It's huge. Yeah. And psychologically, it affects everyone. You'd be surprised that even people that you have never met before, but the fact that they are part of what you do, I like to refer it as the brotherhood. You know, we are in arms together in order to serve the public. Yeah. Whether it's a police officer or it's a EMS personnel, EMS, it's emergency medical services. Whether it's a firefighter from Transnet or a firefighter from the Airports Company of South Africa or a private fire department, the fact that this is a firefighter that is injured, it feels like you are injured. Because when we are together, you're an extension of me, I'm an extension of you. And if you are injured, I'm injured.
Do you ever feel, though, that the task of being the brotherhood or being those who are responding in disaster situations is a thankless job?
I wouldn't really say it's a thankless job. However, a lot of times in our country we do feel unappreciated. And I think that's one of the reasons why the Brotherhood is trying to send a message out to say, listen, we might be firefighters, we might appear strong, we might appear as if we are able to do anything and everything that you require us to do, but we are human.
Yes.
You know, and we get affected just as easy as you get affected.
The thing is, not many people can do the way that you do, right? Not many people can respond in the way that you respond. What's the conversation around the Brotherhood? Do they ever at some point feel, you know what, maybe I should go and do something else, also be in an air-conditioned office somewhere, as opposed to being out here?
Oh, believe me, it does. It does. It does nearly all the time. But we are lucky to have been trained to an extent that we are able to withstand not only the pressure at work, the critics, the one thing that gets to us most is the attacks.
Yes.
You know, nothing hurts more than you leaving your family and rushing to go assist another family. Yeah. And instead, when you get there, you get attacked. Yeah. You know, we get stabbed, we get robbed. Our sisters get raped.
Of fake calls, being called out with a fake call and actually being ambushed as you go out there to assist. I mean, that must honestly affect you every time you get a call to say, how do I go out? How do I know it's a real call, it's a genuine call?
It does, and it's scary, if I should put it that way. When you report, when you respond, you don't know whether you're going to come back. It's scary. It's really scary, because in your heart you want to go out and assist, but in your mind you're thinking, am I going to assist or am I going to get ambushed? Yeah. You know what I mean? And unfortunately, it's not our whole community that does that. You know, it's those individuals that, I don't know if they happy to see other people suffer, but there is those individuals in our community, unfortunately. Yeah. But yeah, it's really scary, if I should put it that way.
Your response to how you protect these first responders as they go out. I mean, it's your team that you really need. It's the capacity that you really need. Yeah. How do you protect them?
Look, we have been engaging the communities to say this is part of service delivery from government. And if you see a fire engine is coming to the community, and then you start roping the crew, next time on your phone, then no one's going to respond because they're afraid. So we have been engaging the communities to say, see this as people are coming to assist in the community. They're not your enemy, and then there are people who are coming to assist the community. Because sometimes, if you have got fires, and then the fire engine is coming there to assist, you might find that you've got elderly, small kids, and so on. And then the mere fact that we have got a fire engine there, actually, it might prevent any death in that community. So now and then we work with communities, we educate the community to say, don't attack the firefighters, because it really affects them.
Let's take some WhatsApp messages coming through also tonight. This one is, of course, coming through on WhatsApp. Boniswa in Durbanville. I don't think South Africa is ready for any disaster. The local government has no plans to address its own issues before the disaster strikes. Alexandra Council has failed to have a disaster plan for floods. Cape Town municipality also failed to have a disaster plan. The money is there, but it is chowed by corrupt, greedy and selfish people in government. And there's a question that I wanted to ask you, Prof. Almain, on that score. Okay, let's take this question as well from Ronald. When one experiences a disaster, where can you phone first between the police department and the disaster management authority? Okay, that's for you, Dr. Sitole. But Almain, let's talk about that question of plans in place. What evidence do we even have that provinces have got plans in place or local municipalities have got disaster response plan in place?
Yes, so that comes back to my remark that we must ensure that the Act is implemented. Every sphere of government must have a disaster management plan for municipal areas. And it's also interesting from what the studies, and that's why I in the beginning said that since the disaster management is the responsibility of the Minister of Cooperative Governance, it falls in strange places within the municipality. So it's not directly linked to the municipal manager. and as such don't always have oversight. You hear stories about people on district level, that sit somewhere in a fire office, they've totally forgotten, they're trying to make plans, to draw up plans, to get the attention of the municipality to take disaster management serious, and it's just not being taken serious. And that's also why I said, maybe COVID made this a national issue, that we all understood that there's something like a disaster management plan, and that we should start to ask questions about it also on municipal level, to ask, do you have a disaster management plan? There's quite detailed set out in the Disaster Management Act what must be in the plan, and what's quite interesting, what must also be in the plan is a procurement plan. How the municipality or the province will procure things quicker during a disaster. So all those things are supposed to make that moment where the hazard becomes a disaster and we need to address it. All those other things should be able to fall in place in terms of the legislation, but it is just not. And I think that WhatsApp that you just read now, I think it's bigger than just the Disaster Management Act. I think it is the problem that we have with implementation of legislation and then local governance in South Africa especially.
Dr. Stoll, a quick 30 seconds for me.
Yes.
Where do I phone? Do I phone the police or do I phone the Disaster Management Office when a disaster strikes?
The municipalities are the first responders. If there's a disaster, we always encourage the community to phone the municipality.
And what is the expectation? That the municipality will be able to adequately respond?
Look, as a province, we play an oversight role to the municipalities. We know that they are capable and are able to respond to any incidences and disasters, but municipalities also, there are two components there. You've got disaster management and then you've got fire services. So any cause which comes in will come to the fire stations, and then fire services in the form of whatever resources is needed to deal with that particular incidences, they will actually dispatch it. And thereafter then the disaster management will come and then augment the capacity for fire services. If the situation escalates, then the province comes in.
Gentlemen, let me thank you very much for joining us tonight. We're out of time. Appreciate you coming through. Dr. Suleiman, thank you very much as always. A pleasure to have you on the line. And Professor Almain, much appreciated, and thank you very much for your time tonight. In the next hour, in conversation with the Cricket SA's Transformation Ombudsman, Advocate Dumisa Nsebenza, as we talk the transformation of cricket South Africa. The Newsfeed late night updates you on what's leading in the news. Next, stay with us.